The member for Mayo has the call.
Thank you, Mr Speaker. My question is to the Minister for Health. Minister, I have appreciated your open door to discuss health issues relevant to my electorate of Mayo. Would you please provide an update with respect to the possible expansion of headspace services in Mount Barker, Strathalbyn and Victor Harbour? And secondly, would you please provide details of the government's commitment to fund $20 million to improve drug rehabilitation services to South Australia with a dedicated facility in Mayo?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the member for Mayo. On a number of occasions now we've discussed the issues both of mental health and also of drug rehabilitation and drug services within her electorate and within country South Australia more generally. And we know that there is a challenge. The national suicide rate is approximately 11.8 per 100,000. Sadly, as challenging as that is, it's even higher, at about 13.9 per 100,000 in country South Australia. And so that, of course, includes the vast bulk of Mayo and Mayo residents. Importantly, the government has been investing very significantly, almost $100 million a year in headspace and across South Australia. We've added a new service in Whyalla. We've expanded our service to Mount Barker. And we've also added new psychological services across the Fleurieu Peninsula and across the Adelaide Hills. Going forwards, we've also, and the Prime Minister went to South Australia to announce an additional $51 million for headspace, of which $39 million will be directly related to headspace services and centres around the country. That could include the potential, and I am working with the member specifically on this question, for capital facilities in relation to the Mount Barker area, where $6 million is available. But we are also looking at the expansion of outreach, as has been proposed in other areas of country South Australia by the member for Barker and the member for Grey. The member for Sturt has been a very important advocate as one of the founders of Headspace across Australia. And so we are looking at that, and I am very hopeful that we'll be able to achieve something. The case is strong. They accept that given the very tragic suicide rates and the youth mental health challenges we face. And in addition, we are looking at expanding outreach services. I know that the member for Indi also has very significant challenges in relation to Wangaratta, in the same way that we've been able to work with Grafton and with Lithgow, where there have been spikes in suicide due to what are sometimes called suicide clusters. In relation to drug and alcohol rehabilitation, we announced $40 million at the budget. Indeed, the Prime Minister announced that as part of his budget work, $20 million will go to education focused on South Australia for drug and alcohol rehab, but $20 million will be released for public grants by the 30th of November. We will be calling for contributions for areas of need, projects that will make a tangible difference, whether it's in a drug rehabilitation service, a drug and alcohol outreach program, things that will literally have the potential to save lives and protect lives. I'll be inviting all South Australian members to work with their community to apply for those, and I thank the member for her sincere focus on this.